In 1976, the Department of Mental Health funded 44 early intervention programs throughout the state. In 1978, the Department of Public Health received initial funding for 12 sites. In 1980, the Massachusetts Early Intervention Consortium Board was created. In 1980, Public Law 89-313 provided funding to support and assist local early intervention programs. In 1980, Sam Mizell, the founding father for early childhood services, submitted a report to legislature on importance of early childhood development. In 1983, Senate Ways and Means Chair visited the Concord program site. In 1983, Department of Public Health became the lead agency.
Hello everyone, this is Ron Benham. I am the Bureau Director of Family Health and Nutrition at the Department of Public Health. Also serve as the Part C Coordinator for Massachusetts, which means overall Director of Early Intervention Services. I've been asked to offer some thoughts on changes in the early intervention system in my near 30 years of working for the Department of Public Health, and I would tack on 5 years of working at the Cape Cod Child Development Program as the Executive Director, and that's sort of where the beginning of my early intervention journey began when I was asked by Barbara Prindle-Eaton, who was pregnant at the time, if I could attend some meetings for her with what I will refer to as a wild group of young women who were very bright and talented and very good advocates and wanting to grow what was in a quite small early intervention system that was statewide, but was shared between the Department of Mental Health at the time, which included both Department of Mental Health and then Department of Mental Retardation, now Developmental Services. I started going to meetings usually held in Worcester. Ellen Berger, who is a occupational therapist, I believe, teaching at this point in Springfield College program, was one of the major leaders of this. This group sort of formed also the backbone of what became the Early Intervention Consortium, of which I'm proud to say I was a charter member. But an awful lot of the activities at that time were trying to build both some degree of consensus of direction for the early intervention system and also to identify ongoing leadership and champions legislatively who would assist us in getting there. Sort of my earliest sort of memories of post that time were starting to work for the Department of Public Health in 1983. At that time, the early intervention state staff consisted of Andrea Schumann and myself. And over time that grew. We started to have more people who came in as program monitors. Tom Coakley probably is a person that stands out for many of you who was there for a long period of time. And then that sort of evolved into a steady group of individuals who have done really great service in terms of being regional specialists or regional monitors.
Between 1983 and 1985, development of unit rate budget was created. In 1983, Carl Kastroff was hired as Director of Child Development Unit and the first Part C Coordinator for Massachusetts. In 1985 was the implementation of unit rate. In 1985, Medicaid funding reimbursed for EI services.
1983, we were working to build off of several things. One was that we had identified legislative champion, State Senator Jerry D'Amico, who was very supportive of the early intervention system. And a lot of us took guidance from a report that Dr. Sam Mizell, who was then at Tufts University, Elliott Pearson School, who is now head of the Erickson Institute in Chicago, had done a report outlining the changes that he felt needed to be made. This was a report that was funded by the Massachusetts Developmental Disabilities Council and indicated that for early intervention really to grow and thrive in the Commonwealth, it needed to have more of a designated lead agency. It needed to offer transportation services. It needed to have operational standards that guided a level of consistency across the system, and also that it needed to attract additional funding sources. So that was sort of a guidepost that was coming out prior to my coming to DPH. And then as well, one of the things that took place very much during the same 1 to 2 year time period is then State Senator Chester Atkins, who was also chair of the Senate Ways and Means Committee at that time, went on a site visit to the Concord Early Intervention Program and ended up spending the morning there and was very positively influenced by what he saw and started to add money over the next couple of years into the early intervention system. And then in the fiscal year 83 budget transferred responsibility for the operation of early intervention to the Department of Public Health. Also strongly encouraged, if not even stronger language than that, for the state Medicaid program to start paying for services, which set a variety of things in motion, including movement at some point towards private insurance being paid, but that's a little bit later in the story. But it did charge the department with identifying a way to bill for Medicaid services. So over a 2-year period from, I'm going to say 83, 84 to 85, there was a lot of work by a consultant named Claudia Harrison, who was an occupational therapist and an MBA, who developed a report indicating what would take in terms of a unit rate, which is essentially in terms of the way services are billed, was developed then and is in place now with rate changes along the way. In 1985, Medicaid began paying for services. If memory serves correct, I think the first year of billing was about $800,000. Presently, it's well over $50 million. So a lot of progress has been made in terms of generating additional revenue stream.
In 1986, the system moved from individual education plans to individualized family service plans. In 1987, the Massachusetts Early Intervention Program served 6,505 children. In 1988, CECEIP was established at the Eunice Kennedy Shriver Center under Director Trudy Latsko. In 1988, Massachusetts received federal Part C funding. In 1990, private insurance payers were required to cover EI services.
Picking up from 1985, one of the things that the movement to billing of Medicaid set in motion was a desire on the part of the Early Intervention Consortium and other stakeholders to attempt to secure third-party payment for early intervention services. And this was, I wouldn't say I guess I might say it was a bit of a radical idea. There were very few things then where one could ask for a state mandate to pay for something. And as I recall, there were bills that were offered for 2 years in 1986-87 budget sessions. And those were supported certainly by the consortium and others. But at that time, the consortium did not employ a legislative advocate or a lobbyist to support its efforts. And then moving forward over the next 3 years until its passage, the consortium did move forward in hiring someone to do a lot of the work. Mary Lou Maloney was someone who worked very well legislatively to sort of move that process along. And eventually, in 1990, third-party legislation was passed with a cap on services of $2,400, which at that point in time was roughly the average cost of the service for an individual child. That has, over time, it fully went into effect about a year from its passage. So in 1991, as employers had the opportunity as well as plans to roll it into their next annual, usually on a calendar year basis, renewal of benefits. So by 1991, third-party payers were paying for early intervention services. That was not without its own rocky road start. It took some period of time before, probably 2 or 3 years, for most insurers both to get fully on board and for there to be the development of more uniform policies on the part of plans of how they would pay for things. Over the course of the next probably decade, we saw changes in that cap from $2,400 to $3,200, and then later into the 2000s from 24 to 32 to 52, and then in the late 2000s moving away from there being a cap at all in terms of what private insurers would pay. And at present, that accounts to approximately $40 million in support for early intervention services in the Commonwealth. The other changes that were occurring during that time period in 1986, Public Law 99-457 was passed, signed into law by then President Reagan, and what created Part H, or the Infant Toddler Program, that was funded under the Office of Special Education Programs under Federal Department of Education. Commonwealth began receiving funds, as did other states, in 1998. I believe our first grant award was something around $800,000. The state was given 5 years. All states were given 5 years to plan services with requirements occurring in each of those succeeding 5 years to make changes in your system, moving to the end of the 5-year period with something that would be either an entitled or quasi-entitled service. Probably around year 3 of that, states were offered, if they chose to accept, a 2-year extended period, so a full 7 years to fully implement their systems. And it's important to realize and to reflect back in time that we had a reasonably well-articulated system from the mid-70s forward, as that after Chapter 766 was passed, most services that had previously been paid for in terms of state service moved downward in age, particularly what were then referred to as community clinical nursery schools. And so in 1976, early intervention in its modern form was really born in the Commonwealth, and largely at that point operated by the Department of Mental Health and Department of Public Health, coming in 1978.
In 1991, the Department of Public Health initiated the Parent Leadership Project to support parent leaders at all levels of involvement in the EI system.
The remainder of this particular piece we'll be talking about from the early 1990s to the present. I would say probably a hallmark of the 1990s was one of significant change. Specifically, as I probably mentioned earlier, there was tremendous growth in terms of the number of children who were presenting themselves for services, and challenges at the provider level to be able to keep up with that level of demand. A number of additional providers came into the system at that time. That produced some of its own challenges, as historically there was one program per service area. During this period there became multiples, particularly in urban areas. And while after a couple of years that sort of subsided, I think early on that produced some challenges of, well, who was going to refer to whom and how we're going to make that work with multiple providers in the same service or catchment area.
In 1992, eligible children were entitled to services with no more waiting lists. In 1993, the Massachusetts Personnel Preparation Committee developed policies and a framework for certification of EI personnel. In 1994, ICC approved guidelines for EI core competencies. In 1994, certification for EI specialists was demonstrated through a portfolio submission. In 1994, the funding was collapsed into the unit rate. Between 1994 and 1996, the IFSP task force worked on the development of the universal form. In 1994, a public awareness campaign developed video and posters to outreach and identification and potentially eligible children. In 1997, new provider orientation was scaled back to 2 days, where it then earned its name, Building a Community. In 1997, the Massachusetts Early Intervention Program served 17,247 children. In 1997, client-specific database was initiated. In 1997, EITC was awarded to the Federation for Children with Special Health Needs. In 1997, Early Intervention Training was renamed to the Early Intervention Training Center under Director Evelyn Hoslin. 1997, Natural Environments.
Other things that were taking place during that time, and I would say one of the hallmarks of this whole program over the last 30 plus years has been, or even longer, has been the level of changes that it's gone through. We've already sort of mentioned talking about move from a cost reimbursement budget to a unit rate budget, moving from an IEP, individualized education plan, to an individualized family service plan. Some of the other changes that were taking place, really, that were quite significant, In the 97 regulations under Part C, there was a requirement that systems move to provide services in natural settings. Typically, that was not the way this service system had evolved. It had been much more of a program-based model, less of a home-based model, and a great deal of work and challenge presented itself in moving the system towards more services in natural settings, be that the home, other community-based areas such as libraries, Ys, swimming pools, etc., as well as making group services more inclusive, and that was another significant challenge.
1998 Autism Specialty Services.
We also transitioned during that period from a number of developmental day programs that were serving children with more significant needs to a regional consultation model, knowing that many of those children who were present in developmental day programs, of which, as memory holds correct, were 4 in number, simply if children were not in the right geographic locations, they weren't getting the same type of services that others who were fortunate enough to be living in areas where they existed. So the movement was to regional consultation programs where funds would be set aside to support children with more complex needs or other kinds of training activities. And that has been ongoing since that time. There have certainly been ebbs and flows of money that we've had available to support the RCPs, but certainly from my own personal perspective, I think a very needed and needed service. The other major thing that took place in the late 90s was establishing what we call specialty services programs, hiring Tracy Osbar to oversee that. The major move in that was both providing direct contracts with Perkins School for the Blind around children with visual impairments and other vision-related issues, funding for through early intervention programs with the various sort of schools for the deaf or agencies serving children who are hard of hearing or deaf. And then a major piece was expanding into children with a diagnosis in the autism spectrum, which in 1998 was not growing rapidly, but the beginning stages of that certainly were being set up. In 1998, we contracted with, I believe, 11 specialty providers who did a range of orientations in terms of their service or philosophical underpinnings. Most of them were either ABA or ABA informed, giving parents opportunities to do whatever seemed to fit best with their lives in philosophical orientations around service or treatment. And that has grown dramatically. And in the last fiscal year, more than 1,400 children with a diagnosis in the spectrum were served at a cost of approximately $12 million plus.
In 2000, development day programs transitioned to regional consultation programs to build capacity and promote inclusive settings. In 2000, revised competencies approved by the ICC and recommended for implementation by the Department of Public Health. In 2001, revision of the early intervention certification process and protocols. In 2002, the Massachusetts Early Intervention Program served 24,522 children. In 2002, Green Book instructions developed for CEIS process. In 2003, Massachusetts Department of Public Health transfers the EI certification oversight to the Massachusetts Department of Public Health. In 2005, the Early Intervention Training Center was awarded to the Education Development Corporation under Director Philip Prince. In 2005, early intervention converted month delay to percent delay. In 2006, the State Performance Plan and Annual Performance Report federal requirement to report on family and child outcomes. In 2006, CAP standard allowance was $2,400 per year. In 2007, the Massachusetts Early Intervention Program served 29,546 children. 2008 Early Intervention Training Center.
One of the unique features of the regional consultation programs that I think families have really both enjoyed and benefited from was our ability to provide some level of support for respite services. This is something that unfortunately has had some degree of ebb and flow. Right now we're more in the flow period, and that we have some resources that we've been able to continue to fund some of the respite activities, but that's been an ongoing major challenge to, I think, keep the RCPs fiscally sound. Some of the other things particularly that we've been Dealing with more recently, we have had some additional opportunity to work with our third-party partners, both public and private. There was a major shift over the last year relative to the provision of specialty services, and most specifically autism services. We received support through the Mass Health Program in a waiver contained within an 1115 community-based waiver to pay for children who are Mass Health enrolled as a class within early intervention who have a diagnosis in the autism spectrum. That rolled out July 1, 2012, and is to provide ABA or ABA-informed services to that group of children. And we are only in the beginning stages of implementation of that, but I think will be a significant cost savings to Department of Public Health. Hopefully those dollars can go into other infrastructure needs within the larger early intervention system. The other thing that I would say, if we look across the system for any number of years, that I think many of us here, myself included, are most proud of, has been the commitment that we have made to families in terms of being respectful in both the service delivery area, but also respectful in terms of welcoming families as active partners in terms of the evolution of this service system, and whether that's through policy development, other types of engagement trainings, trainings that occur where parents are always a part of a training group that takes place around our training center activities. Our commitment is that parents should be very dramatically involved in anything that we're doing. We started the Parent Leadership Project in 1991. That has been, I believe, a very significant success in providing supports for any number of future leaders, not only in early intervention, but probably even more importantly, as they move into their either public school or other school experiences, and where they take, I think, that degree of advocacy on behalf of their own children, but more broadly on behalf of all children, and having better systems of care. So I'm personally very, very proud of that, and proud of what we have tried to do to be supportive of parent involvement across the system as a whole.
In 2008, shift to 30% delay or 1.5 standard deviation utilizing the Michigan Urban Developmental Inventory. In 2010, first dollar legislation. In 2012, the Massachusetts Early Intervention Program served 30,727 children. In 2012, Specialty Services Program contracting. Where we are today.
So I think in summary, there have been very significant changes in this system over the past 30 plus years that I've been involved with it. Certainly some of the things that stick out in my mind that are most important certainly is the move on the part of the Office of Special Education Programs to be much more assertive in terms of their influence on the way that we operate the program. And a lot of that, I think, has been actually quite positive. We've moved dramatically forward, I think, in terms of identifying how we report on outcomes for children. I think the Commonwealth should be very proud of the work that is being done, and that we can demonstrate significant improvement for children based upon their participation in early intervention. Patty Fougere has done a terrific job as the annual performance report and state performance plan process was implemented by the Federal Department of Education, and that Massachusetts actually fares very well in the determination process that OSEP does, and the Commonwealth, frankly, is asked often for guidance around some of the federal policies that would be put in place. I think some of the ongoing challenges we face have been related particularly over the past, I would say, decade, have been potential changes in eligibility. Oftentimes this was a result of, again, ongoing or explosive growth in the system, be it more general early intervention or specialty services for children in the spectrum, as those numbers have increased dramatically, and how as a state we would deal with that, and oftentimes presenting scenarios where either there would be actual reductions in eligibility, making it more difficult for families to be served, or at least proposing those things, and hopefully they would never take place, which has occurred in a number of times. We have also, Over time, implemented a family fee structure, which I know at its core is not terribly popular. That was done as well to help offset some of the shortfalls that occurred over time within the program. There is activity now potentially either to lower those or seeing what guidance we receive from the Federal Department of Education around actual cost of services, and we're waiting for guidance as we continue to deal with the fee structure and issues and at what level it should exist if it exists. It's been an enormous pleasure guiding the system or participating in the guidance of the system for many years. I feel like at times we know we're quite unique in terms of numbers served, but we're absolutely unique and blessed with the quality of staff and the commitment of staff and families welcoming us into their lives and into their children's lives to provide what I hope and believe are very high quality services. And for that, I think we should all be enormously proud.